Another key technique for health coaching is closing the loop. Think about that time your friend or family member went to the doctor. You ask them, "What did the doctor tell you?" About half the time they say, "I don't remember." That's why closing the loop is so important. One study confirms that only 50% of the time do patients remember what their doctor told them in the visit. Closing the loop is an important way to make sure that the person that you're taking care of always remembers what was in the visit. How to close the loop? Ask the patient to summarize what they understood from the visit. A couple ways to say that are, could you repeat back what you learned from the visit? Or just to make sure that everything was absolutely clear in the visit, what did you understand from today's visit? This is all very helpful to make sure that the person walks away with some new knowledge from the visit. Now, if what you hear is on track, congratulate them and say, exactly right. That's exactly my understanding is what the provider told you during the visit. If they're off track, gently remind them what they might have heard during the visit and see if you can ask them to repeat back again what you heard in the visit. Some topics are very complicated and might require repeating back multiple times before moving on. Let's take a look at a video with an example of how to close the loop.
Closing the loop is done during patient encounters. For instance, patient education and discussions about medication changes. Closing the loop is when the coach finds out if the patient can retell the information the coach has said. In this next scene, you will see Lucia, the health coach, discussing medication changes with the patient after the doctor has already left the room during a post-visit. Lucia doesn't close the loop, and she doesn't discuss the patient's concerns about her medication changes.
Hi, Cherise. So I see that the doctor wants to change your blood pressure medication.
Okay.
So he's increasing your benazepril from 20 milligrams to 40 milligrams per day. Does that make sense?
But he didn't give me a prescription. How can I get new medicine?
So he actually sent it to the pharmacy. So all you need to do is go to the pharmacy after your visit and pick it up.
Oh, but I can't go to the pharmacy today.
Well, this medication is really important, so you really should go today.
Okay. Do I really have to take more medicine? Can I do something else?
So this medication helps lower your blood pressure. So if you don't take it, then your blood pressure is going to go even higher. And if it's higher, then you have to take even more meds. And your doctor's concerned because of your family history. So if you take it, it's going to lower your blood pressure and decrease your risk of heart attack or stroke.
My blood pressure doesn't feel high. I know that when the doctor takes it, it's high, but he makes me nervous. I feel great.
Cherise, you might feel great, but your doctor thinks your blood pressure is too high.
What you just saw was the coach telling the patient what to do, and she didn't close the loop. Now you will see Lucia listen to the patient's concerns, do patient education, and close the loop.
Hi, Cherise.
Hi.
So I see that your doctor wants to change your medication to help you better control your high blood pressure. How do you feel about that?
I feel okay about that.
Okay, so he wants to increase your benazepril from 20 milligrams per day to 40 milligrams per day, and he sent over the prescription to the pharmacy. Do you think you'll be able to pick it up today?
Yes, I can go after I'm done here.
Great. So let's say starting tomorrow, how do you think you'll be taking your medication?
I'm going to take the new pills.
Good. And do you know how many milligrams that is?
40 milligrams.
Great. So how do you feel about talking a little bit more about your blood pressure?
Sure.
So what would you say the blood pressure is a measure of?
The pressure in my body?
Okay, yeah. So blood pressure measures the pressure inside your blood vessels. So it tells you how hard your heart is working. So what does that mean to you?
My pressure is too high, so my heart has to work harder.
Mm-hmm. Do you know what your number should be?
I don't know.
So ideally you want your blood pressure to be below 130/80. Do you know what your numbers are right now?
My numbers are 150/95.
Okay. And what's your goal?
Under 130/80.
Great, that's right.